Ohio is facing a serious shortage of behavioral health professionals, leaving more than 2.4 million Ohioans without suitable access to care. Director Leanne Cornyn with the Ohio Department of Mental Health and Addiction Services is here to talk to us about the launch of a new recruitment campaign aimed at growing and strengthening the field. Thanks so much for joining us. First, let's start with the basics. What is behavioral health and what does it all encompass?
Well, behavioral health really is a key part of our overall health. It refers to things like mental distress, maybe mental health conditions, suicidal thoughts and behaviors, and even substance use. And we know that about 40% of Ohioans are living with some kind of behavioral health disorder. So it's prevalent in our state.
So tell us more, why are we seeing a shortage of behavioral health professionals and how are you guys addressing this at the state level?
Well, under Governor DeWine's leadership, we have done such a great job in the state of Ohio in really chipping away at the stigma that historically prevented so many Ohioans from seeking out help for their mental health condition or their substance use disorder. So that's a good thing. We also have done a really tremendous job over the past decade at building out our behavioral health workforce. In fact, since 2013, we've nearly doubled the number of professionals who are serving in the behavioral health field. Unfortunately, though, at that exact same time, the demand for services has increased by over 350%. So while we have more folks working in the field, the demand is double the supply of new professionals. And so we have so many communities that lack access to care.
People may not be aware that there are so many jobs out there in this field, behavioral health. In fact, more than 120 career paths. Can you highlight some of those for us?
Absolutely. Behavioral health is an incredibly diverse field with so many different career options. As you said, more than 120 of them. And those include everything from entry level positions for somebody who may have a high school diploma or a GED, all the way up to college degrees and master's level professionals, and even individuals with medical degrees. So we need psychiatric nurses, we need social workers, psychologists, psychiatrists, therapists, even individuals with lived experience who have themselves struggled with a mental health condition or a substance use disorder. Counselors, so many different professionals are needed within this field.
Ohio also has what's called a wellness workforce campaign. People are going to see campaign messaging. Where are they going to see that? And can you tell us more about this campaign?
Sure. So the Department of Mental Health and Addiction Services, in partnership with our friends at the Ohio Department of Higher Education, have launched this wellness workforce campaign. And individuals are going to see uh, commercials on TV, on radio, on social media, all directing people to check out our website, which is mha.ohio.gov/wellness workforce. And what I think is so special about this campaign is we're trying to build awareness, but we're using real life professionals who are working out in the field all across the state to really drive home what is so special about working in behavioral health. And that is the opportunity to really have purpose, to give back to your community, to really help transform lives. And we're putting our money where our mouth is at Ohio Moss. Since 2022, we have helped support nearly 2,000 college students all across the state with over $23 million in scholarship funding to help support them in their pursuit of careers in community behavioral health. We've also launched a Welcome Back campaign that has provided individuals who left the community behavioral health field with sign-on bonuses to come back into direct care. And we've given out more than $1 million in those sign-on bonuses. So we're trying to advertise, raise awareness, help attract more people into the field, but we're also supporting people in doing that. And then when they get into the field, we want to support them to stay there too. And so through our Workforce Technical Assistance Center, we're providing training and professional development to really help folks develop the skills and the confidence they need to stay in this industry.
Who might be eligible to get into a career in behavioral health? I understand you're looking for everyone from graduates to people who maybe are considering a career switch.
Absolutely. The community behavioral health field is for truly anyone. Maybe you're a young person coming out of high school or college. Maybe you're a mid career professional who is thinking about a career change. Really, what we're looking for is somebody who has passion to serve those who are experiencing maybe some of their most challenging moments. And so, whether you have a high school diploma or a master's degree, there are opportunities for everyone.
If someone's watching right now and considering a career, as you just talked about in behavioral health, what message do you want them to know?
If you are interested in making a change, now is the time to learn more. And there's no better place to start than on our website, which is mha.ohio.gov/wellness workforce.
Leanne Cornyn, appreciate your time here today with us on WTOL 11 News at 4. And people, we just put up that information. They can get some more from you if they're interested in these careers. Appreciate your time today.
Thank you.